This week, we'll be discussing healthcare in the United States. Between this lecture and other materials in the class this week, we'll be discussing the state of healthcare in America, major U.S. healthcare programs, the Affordable Care Act, and other healthcare proposals that are being considered. The thing to keep in mind with everything throughout this week's lecture is that the U.S. spends more on healthcare per capita than any other country in the world. So this graph looks at healthcare spending per capita and life expectancy. We would assume that the more people spend on healthcare, the higher their life expectancy. In the U.S., that is not necessarily the case. So the U.S. spends over $8,000 per person, which is over $2,000 per person more than the next largest country, but the U.S. has life expectancy similar to countries such as Chile, Poland, and Czechoslovakia, despite spending more than any other country. And we need to ask ourselves, why are we not getting kind of the same bang for our buck? Why is it that we're spending so much and not getting that life expectancy? That's for a variety of reasons, which will be explored more in the additional supplemental videos and readings for this week. But the thing to keep in mind is the U.S. has many large health insurance programs. The first is Medicare. So we have Medicare and we have Medicaid. So to kind of understand the difference between the two, Medicare ends in with E for elderly. So this is for individuals age 65 and older. And then there's Medicaid, ends in D for destitute. I don't love the word destitute, but it is a good way to remember the differences between these programs. So Medicare is for older adults. Medicaid is for low-income individuals. There's also CHIP, which is the Children's Health Insurance Program. So this is specifically for children. So Medicare, again, it's federal health insurance for individuals over the age of 65 and also some individuals with disabilities. The main thing that Medicare covers is free inpatient hospital stays for anyone who's eligible. And they have a variety of other services at an additional charge. But at its core it's at least providing free hospital stays for anyone over the age of 65. Medicaid in the state of Kansas is called CanCare. So Medicaid is for low-income individuals. The thing with Medicaid is it's administered by the states, but it's primarily paid for by the federal government. So about 90% of Medicaid is paid for by the federal government. However, since it's administered by the states, eligibility requirements are determined to each state, and what services are going to be covered are also determined by each state. In Kansas, to qualify for Medicaid as an adult, number one, you have to have kids. So if you are an adult in Kansas and you do not have kids, you would not qualify for Medicaid or CanCare. If you're over the age of 65, you would qualify for Medicare. But Medicaid is only for adults with kids, and you have to be below 38% of the federal poverty level. Medicaid does provide a more variety of services free of charge for individuals. So they'll cover preventive care, doctor's visits, x-rays. Some states cover dental services. So Medicaid covers all of those. So Medicare only covers hospital care for free. Medicaid covers more of what we would consider the spectrum of health insurance coverage. There's also CHIP, which is the Children's Health Insurance Program. So this is for low-income children. So you can have up to 200% of the federal poverty level to qualify. And in Kansas, CanCare covers both people on CHIP and kids who are also on Medicaid. So it's kind of an umbrella for various programs. In the United States, we also have what was passed in 2010, which is the Affordable Care Act. So we'll go into more detail in one of the readings and videos on the Affordable Care Act and what all is incorporated in the Affordable Care Act. But if we look at the word affordable, the goal of it is to make health insurance more affordable. We had kind of skyrocketing costs for insurance. A lot of people didn't have health insurance, so they were uninsured. And the Affordable Care Act was a way to get people health insurance at a reduced price. The Affordable Care Act is also known as the ACA, Affordable Care Act. It's also synonymous with Obamacare. It's all the same thing because it was passed by President Obama, but all of these are part of the Affordable Care Act. Two of the big things that it did to help make insurance more affordable was it provided subsidies or tax credits to help individuals who are middle to low income purchase health insurance. It also expanded Medicaid. So again, Medicaid is for low income adults. So it expanded Medicaid to all adults who had income below 138% of the federal poverty level. So that's around $17,000 for a single adult without kids. The other thing to keep in mind is, again, the federal government pays most of the cost for Medicaid expansion. So 90% of the cost of expanding Medicaid to these additional individuals is being paid by the federal government. However, the Supreme Court ruled in 2012 that states could not be forced to expand Medicaid. So while it would be assumed that all states would want to expand it, since it was mostly covered by the federal government, there are still 12 states that have not expanded Medicaid, and Kansas is one of those 12 states. So by not expanding Medicaid, it's left a lot of individuals who could be eligible for health insurance not able to receive it. So as of 2018, 386,000 individuals were receiving health insurance coverage in Kansas under either Medicaid or CHIP. So that includes children, so it's adults and kids. So if Kansas chose to expand Medicaid, another 150,000 people would receive health insurance. And again, most of those 150,000 people, the cost to provide them health insurance would be covered by the federal government. So right now, Kansas is paying the federal government through tax money, and they are not receiving the money back from the federal government through expanding Medicaid. So right now, Kansas is kind of, people in Kansas residents are paying for other states to expand Medicaid, and they're not getting it in exchange. So the federal government could be, giving the state of Kansas over $7 billion in the form of reimbursements to providers, physicians, nurses. Rural hospitals could be receiving additional funding because more people would have health insurance, that Kansas is kind of leaving on the table by not expanding Medicaid. So if we look at kind of what income levels are people receiving different services. So under the Affordable Care Act, again, if you have income up to 400% of the federal poverty level, you can receive tax credits to purchase health insurance. So that's individuals, it would be a single individual making up to $51,000. Medicaid was expanded up to 138% of the federal poverty level. So that's for a single individual without kids, that would be $17,600. So in other states that have chosen to expand Medicaid, single individuals making up to $17,600 would be able to receive Medicaid. However, in the state of Kansas, it's only adults with kids who are at 38% of the federal poverty level. So that's individuals making $4,800. So in order to receive Medicaid in the state of Kansas, you have to be really, really poor. But if Kansas expanded Medicaid, it would cover up to individuals making $17,600. There's a variety of healthcare proposals that are being considered. So two of the big ones, it's either kind of fix what's broken in the healthcare system, or there's been a lot of talk around a single payer system. I would imagine in the next few years to come, we're looking at more of a fix what's broken system. I don't see us moving to Medicare for all in the near future. That's going to take some time to move towards that direction. But if we're looking at fix what's broken, so you're going to learn in different videos some of the things that's kind of not working in the healthcare system. The U.S. is spending so much money and not getting as much bang for their buck. So they're not getting the healthcare outcome that you would expect given how much the U.S. is spending. So some of the options for the system, the first kind of, if we think about some of the problems in the system, one is that there's still a large number of Americans who are uninsured. So the U.S. can kind of fix that problem by expanding Medicare. So maybe, Medicare is for older adults. So maybe instead of making individuals eligible for Medicare at the age of 65, maybe they're eligible at the age of 60 or 55. The other option is to create a public option. So right now, Healthcare is primarily provided through private insurance companies, Aetna, Blue Cross Blue Shield, Cigna. Those are the three largest healthcare insurance companies. The only individuals who receive health insurance directly through the government is if they're on Medicare. So it might be that Medicare is expanded and individuals are able to buy into it. So Medicare is free for individuals over this age of 65, but it may be that, if you're 25, you're able to purchase government health insurance at a cost. You wouldn't get it for free, so you would pay it. So the government's kind of providing another option that is funded by the government. One of the other problems that has been prevalent is really skyrocketing cost of prescription drugs. So it may be that the federal government kind of steps in and negotiates with pharmaceutical companies to cap drug prices because there's not a lot of competition in those markets. So if there's only one person who's providing a certain prescription drug, they can kind of set the price, even though it costs pennies to create one pill. Once they've kind of developed it, the federal government can kind of stipulate what prices can be. So it may be that the federal government caps some of those drug prices. It might also be that the federal government actually produces some of the drugs to kind of create a generic option for individuals. And again, the other kind of option, moving away from just fixing what's broken, is what some people call Medicare for All, which is essentially a single payer system. So under a single payer system, this is where everyone would be kind of enrolled in a national healthcare system. We would pay taxes to the government, and the government then pays for our healthcare. So we wouldn't be paying co-pays or premiums. So currently, we pay premium. So we pay like a monthly fee to our insurance company, who then pays our providers for services. But in a single payer plan, we pay taxes to the government pays the providers, and then we wouldn't have any out of pocket expenses. So this is one thing that has been considered more on the progressive end of the political spectrum. But we still have some ways to go before the U.S. is really going to be fully in this system. So because there's a variety of cost and consequences when we look at Medicare for All. So just looking at various pros and cons of it, there would be lower out-of-pocket expenses because the government would be paying for it. But it would also be, you still have to pay for your health insurance. You just pay for it differently. You pay through taxes. So the government would have to significantly increase taxes to create a Medicare for All system. That's typically how it's been in Western European countries that have nationalized healthcare. The pro is that there would be less people uninsured. So all U.S. citizens would have access to Medicare for All. So not very many people in the U.S. would be uninsured. So there'd be way less healthcare disparities, because right now, if we look at differences in healthcare by income, lower income individuals have way lower life expectancy than higher income individuals. They're less likely to have health insurance. They have if they can't access preventive care, then they have a lot more health challenges. So there'd be fewer healthcare disparities. There's also lower administrative costs because we wouldn't have, 100 different health insurance plans out there. You have one health insurance plan and one system administering it. And we'd also have greater provider options because you could essentially go to any physician would accept this government health insurance program, rather than right now, each physician kind of determines if they're going to accept Blue Cross Blue Shield, Aetna, am I going to accept Cigna? So there'd be no longer any out-of-network charges. However, there's some major cons to Medicare for All. Again, it's extremely expensive, and there has not been one plan to fully fund it. When we had the Democratic primaries for the presidential race, Senator Sanders and Senator Warren both had plans to fund Medicare for All, but their plans did not fully cover Medicare for All. Bernie Sanders had a plan that covered a large chunk of the cost that would be associated for Medicare for all, but it didn't actually cover the full cost. So there hasn't been one plan out there that would fully kind of stipulate how this is going to be paid for. There would also be there would be a loss of jobs, because if you think of all those individuals who work for different health insurance companies, they would be out of a job. Bernie Sanders, part of his plan did kind of have plans in there for retraining some of these individuals to kind of get them working in different aspects of the healthcare system, but there would be some individuals who would be out of a job. There may also be lower provider reimbursement rates. That's been one kind of question mark. How would it affect how much like physicians and hospitals are paid? Because right now, healthcare systems kind of negotiate with different health insurance plans, and under a Medicare for all system, the government would really be setting how much they're going to pay for different services. But the most important thing to keep in mind is there's just a lot of uncertainty, because the U.S. is such a large country. No country of our size has a nationalized healthcare system. So there's just so much uncertainty about what that would look like. So there needs to be some more plans that are brought out before we really move in this direction, to make sure that the U.S. can afford it, and that we have an idea of how we would kind of move everyone towards a nationalized health insurance plan, and away from these private options.